Every day, patients like you depend on healthcare professionals to help you through routine to difficult situations. When incidents of sexual misconduct occur, trust is broken, and the patient is often prevented from receiving needed care. Whether the abuse is one-time or ongoing, it can be traumatic and cause lasting damage. Misconduct can occur anywhere and in many forms. Because the medical board is tasked with protecting the public, it establishes rules for its licensed healthcare providers. Sexual misconduct is exploitation of the licensee-patient relationship that can be verbal or physical, or the expression of thoughts, feelings, or gestures that are sexual. You should always report a sexual assault to law enforcement. Other forms of sexual misconduct, in addition to sexual assault, should also be reported to the medical board. Often, patients don't realize misconduct includes behavior such as inappropriate touching, romantic advances, questions about unrelated sexual history or preferences, failing to provide privacy and proper draping, exchanging sexual favors for treatment, or any use of the health professional's power and position to please themselves sexually at the expense of the patient. Victims of sexual misconduct often don't report it because of fear of retaliation, embarrassment, or denial. If you file a complaint with the medical board, the board may find evidence of sexual misconduct and take disciplinary action against the healthcare provider. Reporting your concern to the hospital or healthcare system is a good thing to do, but remember, the medical board has authority over the provider's license to practice. As a patient, you should always be treated with dignity, regardless of race, national origin, citizenship, religion or creed, gender, sexual orientation, gender identity, age, marital status, disability, or medical condition. Before you go in for a scheduled exam or procedure, consider finding out what can be expected to happen. You may ask questions about how long the exam will take, what parts of your body will be touched, and if there should be any pain or discomfort. When you're seen by your healthcare provider, your provider should always clearly explain what they are doing and why they are doing it at every step of the exam. Your provider may offer to have a chaperone in the room. If they don't offer, you have the right to ask for a chaperone at any time. Your provider should provide you with a gown and/or drape if your exam requires you to undress. Your provider should allow you to undress in private and knock before they re-enter the room. You can ask questions if you are unclear about anything the provider is doing, and you can choose to end the exam at any time. The medical board regulates healthcare professionals across Ohio. You can look up the disciplinary history of any state medical board licensed health professional through the e-license system and any physician or PA in the country using docinfo.org. Always pay attention to red flags. For example, if you are seeing your healthcare professional for a sore throat, it is unlikely you will need an examination of your genitals or need to remove your clothing. You know your body, and if something doesn't appear or feel right, trust your instincts. Contact local law enforcement immediately and file a complaint with the state medical board. Your complaint is confidential and important to the medical board. Even if your case doesn't result in action, it may alert the board of the licensee's inappropriate behavior. Your courage to speak up could help us identify a pattern and seek out additional evidence. You can file a complaint by going to med.ohio.gov and clicking on the File a Complaint button.